last decade or a little more. First is women today are professionally active, whether in journalism, whether in IT, whether in bank, whether in medical profession. So a lot of women are busy in their own profession, so they plan to get married late. That is one major issue which is happening. And what happens is when somebody gets married late and she has a pregnancy for the first time with difficulty also late, so those patients automatically become more precious because they're going to have one delivery or maximum two delivery. So it has nothing to do with the cesarean rate. The entire indications of cesareans have changed by three situations. Women professionally very active and not planning pregnancy early, which is good for the country because the economy survives on not only men, it survives also on women. Second is infertility treatment and advances. So even in my hospital, we have a 52-year-old lady who delivered twins on 28th December 2001. So with the new technologies of IVF, you have elderly women becoming pregnant at 45, 48, 52. Many of them have twins, and all these pregnancies are very precious. Endoscopy clears all the pathologies which were coming in the way. We had a live workshop here, 17 surgeries were done. So that again, because of removal of those fibroids, though endoscopy through buttonhole, and when they're pregnant, if it's at an area wherein it is going to stretch, then again they land up into cesarean section. And the third thing which has affected the cesarean section rate is television. The melodrama in any state. When a patient is pregnant, the whole family is pregnant. The whole family starts acting. You see, anywhere, whether you're in Mumbai, Hyderabad, the hype over a simple pregnancy is like a social big issue. And little bleeding, everybody will come. So nothing less than a miracle is expected from a doctor. No other branch of medicine carries risk more than delivering a child because there are a lot of unpredictable factors. Something like bleeding, the duration taken, tolerance of the patients. We have many patients who come even after cesarean, and we tell, okay, 40% you have chance that we will deliver vaginally provided you have painless labor. So things have improved and changed, but big contribution is late marriages, then pathologies like endometriosis, fibroids and all coming, difficulty in conceiving, infertility and advanced IVF treatment, and lot of solution. Earlier, many times you did an open surgery for multiple fibroids, she landed up with adhesion, she never became pregnant. Now we remove, say, 16 fibroid, 17 fibroid, big fibroid, endometriosis, uterus coming out. All these surgeries are done with buttonhole in private and in even municipal hospital and even in government hospital. Now all these ladies, when they become pregnant, that pregnancy is far more precious because they don't want to lose it. So actually, if you see, cesarean rate is not a barometer. How many normal child you deliver after delivery is the barometer. And if you have somewhere around 22 to 35% of cesarean section rate, and that little rise what we are telling, these are the three factors. If you pinpoint, these are the three main factors. And fourth, as Dr. Purandre was telling, is tolerance of different people are different. They expect miracle. The family wants no trouble for the person who is delivering. The person who is having pregnancy, she wants everything except pain. And nobody in the world can deliver without pain. So I think that there are factors, and overall perinatal health is important. The health of the newborn is important. There's no point in delivering a child and then the child is having some intelligence problem, or the child is having some problem by which doing a cesarean in time would have avoided, and it is a big national resource which we have to restore. So barometer has to be healthy child delivered by cesarean or even vaginally.